Tonight's lecture on the Wolverine protocol, BPC-157 and thymosin beta 4, one of my most favorite peptides that I use at the practice here at Iron DPC. This part will come in three sections. We're going to go through the BPC component, the thymosin beta 4 component, and then we're going to go through a bunch of case studies so you guys can learn about the results we have here at Iron DPC. So we're going to learn about the mechanism of action, the benefits, and the enhanced healing capacity of these peptides. So start with the BPC 157. It comes commonly in injectable and oral, as well as some topicals, as we'll find out. You can find it naturally in tripe. So what you're seeing there is cow stomach. You can eat this, popular in Thai and Indonesian cultures to eat tripe. This is found naturally in human gastric secretions and animal stomachs. But it's been studied over the years since the 90s for healing various sorts of injuries. We're talking here back in 1997, they were looking at it for wound healing. A lot of these were done in rodent studies. It promotes angiogenesis, which is new blood vessel formation. Um, so that's great, angiogenesis, right? We need more blood, more perfusion to promote wound healing. So that's one mechanism for healing. It also is stable in the gastrointestinal tract, so you can take it orally and it doesn't degrade too much like other peptides might. It can be used to heal gastrointestinal injuries like stomach ulcers, which we do quite extensively here, any sort of inflammatory bowel conditions, and even in use in rodent models, surgical anastomosis healing. So that's where you connect two ends of a gut together to promote a healing. The BPC also has CNS and nerve regenerative capacities. It's been studied and used successfully in other effects like periodontitis, liver, and pancreas lesions. There's several mechanisms that you can read about right here that promote the healing, but it can promote nerve healing. So in rat spinal cord injuries, it promotes the healing of transected spinal cords. And in other models where they create a demyelinization. So it's cuprizone therapy. It's a copper chelating agent, and when you chelate copper out of rodents, it gives them like a myelin a degradation syndrome, right? Like multiple sclerosis. And BPC 157 can help modulate the damaging effects of this treatment on rats. So BPC is again great for any gastrointestinal lesions, esophagus, stomach, duodenum. It can also help with NSAID related injuries. We use that pretty commonly here at the practice. Ulcers induced by nonsteroidal anti-inflammatories. BPC 157 also plays a role on nitric oxide, and it can modulate the damage done by chemotherapy agents. Some of you were at my lecture last week for, I think it was a Clearfield group. We talked about the thymosin alpha 1, and these peptides are being studied in conjunction with chemotherapy agents to modulate the damage that these drugs do. BBC 157 interacts with nitric oxide systems, L-arginine, and so forth. Can BBC also help with patients harmed by psychiatric drugs, potentially even help with Parkinsonism? BBC 157 blocks catalepsy induced by Haldol, as well as somatosensory disorientation after sulpiride and clozapine. This suggests a generalization that BBC 157 counteracts the side effects of different groups of neuroleptics, typical and atypical. It may exhibit beneficial effect even after complete dopamine blockade, such as in these typical antipsychotic agents. So that's reassuring because when you have a patient with these damages done by these drugs, there's not any really good treatment for these people other than like tapering them slowly off these drugs. Uh, it has anti-ulcer effects, which can potentially also be an antidepressant effect. When you heal the gut, you heal the brain. We know that in functional medicine. BPC 157 in traumatic brain injury. So they did this in rats. They damaged the brains of rats. And then they gave them the BPC 157. It lowered brain edema, decreased the number and size of hemorrhagic trauma and traumatic lacerations, and mitigates the intensity of subarachnoid bleeding. So that's all things that BPC 157 can do in controlled settings under rats with traumatic brain injury. But we like this product. Back when we could get it in compounding pharmacies, we would do intranasal suspensions of BPC 157 for TBI in patients. This is, again, more on the rat spinal cord injury. I think we could cover that enough here. Here's what we're really interested in is the BPC 157 on its tendon healing abilities. So this is where we use it mostly, right? We use it in patients with musculoskeletal injuries. Typically, we inject it into patients near the tendon, near the area of injury. And it has a seemingly local benefit for inflammation and regeneration. Uh, let's see. Injected VPC, you can see a benefit even after one injection, and anecdotally, we've found that as well. Longer lasting activity has also been demonstrated. No really known toxicity or side effect, even when you're using super physiologic doses of BPC 157 in animal models. There's been no side effects noticed with this. This one here, MCL healing throughout 90 days after surgical transection, again in animal models. After MCL transection, BPC 157 was effective in rats when given once daily intraperitoneally or locally as a thin layer at the site of injury. First application given 30 minutes after surgery, and the final application 24 hours before sacrifice. BPC 157 injected rats exhibited consistent functional, biomechanical, macroscopic, and histological healing improvements. Now, one of the few studies actually done on humans, I think was done in Russia, and they actually injected this into people's knees to promote healing of the knees. There's one of the more recent studies back in 2025, Zagreb. Again, this was in, I think it was rabbits or mice. They took their quadriceps tendon off their bone and then used BPC 157 and monitored the healing capacity of the peptide and showed that per magnetic resonance, biomechanical, and functional assessments, that they improved their walking capacity much quicker than control groups. This is another recent study done in Lithuania. So they're doing a lot of these studies, not in the US. FDA, for some reason, not very interested in these studies. So we're getting a lot of ex-Soviet Union states that are still doing a lot of research on this and interested in it. And again, they're doing it a lot in animal models still. But here they did a reperfusion injury assessment. So they cut off blood flow to a limb, and then they release the blood flow. And when you do this, it causes a lot of damage to the kidneys, lungs, liver. BPC 157 modulated the oxidative stress and inflammatory cascade that results from this and protects the end organs from damage. We're going to move on to thymosin beta 4 because we always use these two together for the Wolverine protocol for their synergistic effects. The thymosin beta 4, it modulates the inflammatory pathways very powerfully. It downregulates NF-kappa B pathways, reduces inflammatory cytokines and chemokines, thereby minimizing tissue damage and promoting healing. By decreasing the production of reactive oxygen species, TB4 protects cells from the oxidative stress. In addition, TB4 influences the synthesis of laminin 5, which strengthens the repaired tissue and helps prevent fluid loss and bacterial infiltration. This is a thymus peptide, as we alluded to in this picture here. It's a gland in the upper part of the heart that degrades or involutes with time. So you have a very large one when you're younger, and you have a great immune system and healing capacity this way. You know, children may be able to jump out of trees and they bounce right out of it. Meanwhile, if you tried that, and you wouldn't be walking for weeks. So the thymus peptide, it helps both with your immune system and healing. It also can potentially modulate the aging process. So TB4 is being looked at in anti-aging medicine to give people back this youthful healing capacity, both for their musculoskeletal system and their immune system. And thymosin beta 4, I found that it may potentially serve as a weapon we have against prion disease. So God forbid, the next pandemic, Somehow we got disease released. Thymosin beta 4 may be one of our only potentially treatments for that, as there isn't really no known treatments for prion disease. Of course, for Jakob, uh, some of these other fatal familial uh, sort of prion diseases. The peptide, the thymosin beta 4, it both protects the cells against the invasion of the prion and helps modulate the damage and death of the cell, prevents apoptosis. Here's a more common problem, dry eye discomfort. So how many patients might you have with dry eye disease? Stinging, burning, redness, irritation, sandy eyes. These are all symptoms of dry eye disease. There's not a really good treatment out there. So there's actually human clinical studies being done right now. This is a company out in Maryland that has this product. It's basically an applicator where they put this non-irritant solution in the eye with thymosin beta 4 at 0.1%. And they're finding that it helps heal the eye, relieve symptoms of the dry eye disease. They're using very low dose. We used to be able to get this compounded before the pharmacies couldn't do this anymore. So we actually don't have this except if you're involved in this study out of this Maryland company. So when the epithelium is injured, the cornea responds by synthesizing again cytokines, growth factors, and tissue remodeling molecules, pro-inflammatory cytokines. Back when I worked in the ER and urgent care, the best you could do for a patient is you give them this little drop in the eye. You tell them they can't use it too often because it'll damage their eyes. It gives them a lot of relief, but the patient just has to suffer. Or you can do corticosteroid drops in the eye that does help with the inflammation, but you can't use corticosteroids long term because you can give someone damage to their eye. Really, we only have thymosin beta 4 as a potential mechanism for a very common injury, which is an eye laceration. So TB4 has clear anti-inflammatory and wound healing properties. TB4 application accelerates corneal reepithelialization and modulates corneal cytokine production, such as IL-1 beta and IL-18 in rat corneas here. So this is some of the studies they've done so far in 2016, 2017, all the way up to 2023 with neurotrophic keratopathy. They've been giving it to a couple different countries to test out this product. Oops, where did it go? I don't know if we're allowed to talk about, it's not a brand name, it's just a company, Regen Tree. Um, that's it there. A couple more models of brain injury for thymosin beta 4 in rats. Thymosin beta 4 again has anti-inflammatory activity and promotes angiogenesis and dermal wound healing in cardiac ischemia models. So they thought, well, let's look at what happens when you injure brains and of rats and give them the stuff. So embolic stroke model in rats, they found that the rats did better when you gave them thymosin beta 4, increased myelinated axons, uh, increased mature oligodendrocytes. Conclusion, TB4 promotes neurorestoration via axonal remodeling and oligodendrogenesis, not neuroprotection, leading to sustained functional recovery. There's another one in multiple sclerosis. Again, they do that cuprizone treatment on them. Conclusion, TB4 enhances neurological recovery post damage, likely through oligodendrogenesis, mirroring the Stokes model mechanism of promoting myelin-producing cells. And then again, TBI, TB4 reduced deficits in the water maze test on the rats and footfall by 75% and 50%. Let's talk about the cancer because when I talk about these peptides and you hear about angiogenesis and delays apoptosis, you wonder, well, could that cause cancer? Well, the answer is tricky here. It doesn't cause cancer, but as we'll see, it may be implicated in some cancers, and it may be protective against others. So exogenous thymosin beta 4 suppresses idiopathic pulmonary fibrosis lung cancer in mice. So they're doing in vivo and in vitro studies in the animal model and showing that thymosin beta 4 alleviated the impairment of lung function and severity of damage of the alveolar structure by pulmonary fibrosis and inhibited the proliferation of lung cancer tumor growth. Um, so the results showed
Let
that
me
boosting
add
thymosin
here,
beta 4.
Dr. Stefan, let me make sure that people here will not get injecting people with cancer with thymosin beta,
Yeah,
although it
we're
shows that.
We're
because
gonna
it
get to that.
will, yeah, I know, but directly maybe in lab, but in real life, there is other factor which is the immune system, and
Exactly.
thymosin beta will polarize the immune system into Th2 and Treg, so it may goes protect the cancer against the immune against cytotoxic T cells. So I will not recommend thymosin beta for cancer patient, but I will recommend thymosin alpha for cancer
Okay.
patient because it polarizes the immune system to Th1. And maybe
Right.
there's some direct effect on cancer directly, yes. It will modulate the redox and in that way, which is going to be some compromising the cancer there. But at the same time, it's not good for the immune system because it polarizes the immune system away from cytotoxic T cells and Th1, which is something we want to do at the opposite. Just a little
Right.
injection there so that the doctors will not be injecting thymosin beta into patient with cancer. It's completely prohibited to do that.
Correct. We would do the opposite. We'd do thymosin alpha 1 if the patient has cancer. Uh, Thymosin beta 4 is a potential marker of malignancy and prognosis in hepatocellular carcinoma. So when you have a patient with a cancer, they're now looking at using TB4 as a marker of monitoring this cancer because it appears that it's actually a better marker than previous markers of cancer monitoring. Um, so you take that what you will. It's a marker. It does not necessarily causes it. I wouldn't give a patient thymosin beta 4 if they have a cancer, if I know of it. Um, so there's that. But now let's look at some case studies here, and you can see some real life applications, day-to-day clinical practice at a primary care clinic. So this is a patient, we see this all the time, shoulder pain, right? The patient describes shoulders feeling better with the addition of the peptides. It's not 100%, right? It's not a miracle. You still need to do physical therapy. You need to have a good diet. You need to do the cold plunge, the therapy, and so forth. But it helps promote the healing, it helps patient cool off the pain, helps prevent that cytokine storm of pain. This patient met her at the office for follow-up. She wanted more peptides. She walked in without a limp. She says she would have been in a wheelchair if not for me. She's astounded by the power of peptides. She said it improved her life dramatically. So we typically have patients do 1 milligram BPC and about 1.25, 1.5 milligram thymosin beta 4. You mix it together, you draw it from both, and you inject it. A young tennis pro strained. He wasn't healing the groin or the back, or something of both. It resolved within 10 days of doing the protocol. This is a bodybuilder, neck pain after an MVA. I actually sent him to a spine surgeon because he was having a little weakness and was concerned, but he now no longer is pursuing surgery because the peptide has helped him so much. This is another bodybuilder type. He's got knee weakness and shoulder pain, tender right deltoid. He had another injury, and so we gave him a peptides, and he started being able to do overhead presses and again, feeling a lot better. He's a fireman, age 35, so I'm at the office, assess his shoulder. He had some pain. It wasn't like a rotator cuff tear, it wasn't anything serious. We injected some peptide. A week later, he says, "Hey, follow up, shoulder feels fantastic. Thank you again." Here's a 61-year-old female. So I actually I did injection, intra-articular injection for this patient, and she did remarkably well. Now, I don't just do the peptide. I actually extract the platelets and I mix the peptide in with the PRP, PRF. Gently, of course, right? You don't break the peptides. You don't centrifuge the peptides. You extract the PRP, you mix the peptides in, and then you inject it into the patient's knee. Now, typically, when you do this to a patient, they say it's going to be painful when you inject PRP because it causes inflammation. This is not the case with this patient. Every time I've done this for the patient, she describes actually feeling great the next day. So much that this patient, she came to me the day she's going to go to Rome, walk 20,000 steps seeing the Vatican, and because she knew it would help her so much. I give her the injection. She's walking 30,000 steps in Italy the next day after she limps into my office because she has bad knees. And so she goes to the orthopedic surgeon who wants to do surgery, of course, is what orthopedic surgeon does. And he doesn't believe it. He's like, there's no way a PRP makes you feel better the next day. She's like, no, it does. And we've done this multiple times for it. It usually lasts about 2 to 3 months. So though,
Let me add something here, which will help the case here.
yes,
And it's good for also understanding regenerative therapy in general, and also making sure you don't, the doctors, they don't make a claim. Like this orthopedic doctor, in his mind, those platelets will regenerate the cartilage. But that's not the case. We're not really here to target the cartilage because regenerative cartilage is clinically insignificant with all regenerative therapies, including stem cells, PRP, and all that. So what exactly the PRP does, it helps to regenerate and it helps to reverse those stunned synovial cells that's in the synovial membrane that produces the lubricants. So when you inject those PRP or those thymosin beta, you're decreasing the inflammation of this capsule, which is the synovial membrane. And those synovial cells that's being stunned by inflammation, they don't produce enough of lubricant. They start working up and they start producing lubrications or lubricants. And that's the reason they feel better because of the increasing in the lubrication. So that's the effect of almost all regenerative therapy here. And I think this orthopedic, if he understand that we are kind of working on the synovial membrane, not the cartilage, I think he will be open-minded to understand why we are having good results out of the PRP, even if it's bone on bone. I have cases bone on bone, and they have a lot of pain, but when they did the PRP, they don't have much of pain, and they can walk. And the reason it's not because we're building cartilage on this bone and bone. There's no cartilage to build on. It's just because of the increase in the lubrication. Does that make sense?
yes. But don't you hear the stories of it's supposed to cause more pain when you get the PRP? They always say that, right? That's what I was told.
There is some inflammatory will induce, but your thymosin beta, it's anti-inflammatory that you are doing,
Exactly.
instantly affecting that. And you're increasing the lubrication there, which will help to ease the pain and the whole thing. Again, the effect that we are getting is just because of enhancing the lubrication, which has long effect. As I said, it can go up to 6 months. That's why they say the PRP effect it's up to 6 months, and then you can start doing it again. But what you're doing, which is a good thing, you are mixing platelets and isonicate it. I don't matter if you break the platelets. In fact, that's better. We sonicate it with the thymosin beta, with the lidocaine, even with hyaluronic acid, and then you get this a matrix, and you get those platelets loaded with the thymosin beta, those platelets nanoparticle, which is the breaking down of those platelets and those growth factors. They all will be kind of forming vesicles or exosomes, kind of. And you with the sonications and with the extrusion and nanoparticles, you're making sure that's in the size of 100 nanometer, and then you inject it into the joint along with the gel. You can use hyaluronic acid as well, all this together. And I think you can even get way, way better results because of that targeted therapy that you're doing.
Uh-huh. So I did your platelet nanoparticle.
You did it, but you need to break it down. The idea of not breaking it down, it's not you if you break it down, because what's happening is that those synovial cells, they are want to eat those platelets, and but it's in the size of the platelets, they cannot eat it. It's like a baby of 6 months. If you give them a whole apple, it's hard for them to eat it. But if you break it down, smash the apple, they can eat it easily. So same thing for platelets, same thing for stem cells. I like to break it down to exosomes and to membrane particles, and then we do the sonications. We have a sterile technique where it doesn't touch the air at all, and extrusion and penetration. You can mix everything, thymosin beta, your lidocaine. I don't like lidocaine, because lidocaine is anti-inflammatory, regenerative. It's not toxic. And then you do your thymosin beta. You can add B12 if you want, whatever you want in this soup. And then you inject it. You can even add hyaluronic acid. Hyaluronic acid with and you can order cyclodextrin. Cyclodextrin gives up some Cushing there, which we are working on getting the cyclodextrin here in the United States, sterile part of it. But I think you can get better results. You can do Clotho in your mix. Whatever you want. You can mix it, put a cocktail, and injecting the joints. And the idea is not building the cartilage. The idea is rejuvenation of the synovial membrane.
Oh, fantastic. So as I alluded to earlier, you can also do this topically, and we can get a BBC GHK copper peptide. We use it for superficial injuries, lacerations, non-healing wounds. In this case, the patient chopped off the top of their finger with a blade, cutting some onions. And so 1 week we had fairly good healing and regeneration. This peptide, this patient says, doing well with injectables. I say, good. What's going on? Definitely less inflammation, less joint pain, less overall swelling in my gut and body. And this is with injectables. So it's both affecting the joints and the guts with an injectable peptide. This 16-year-old volleyball player, she had a game tonight and was overtraining. She pulled her right quad muscle. We injected the peptides right into the quad near the area of strain. And I asked her later how did it go. She said, my leg feels much better and I was able to play without thinking about it. Thanks. So I don't know if in this placebo effect, it shouldn't have worked that fast. That's like the what you would get out of a corticosteroid, like a Kenalog injection. I mean, it's possible, and that's what I'm starting to learn as I use these peptides over the past 4 years. They seem to also have almost a powerful effect as a steroid, like a almost a Kenalog-like effect in some cases. This patient, 62-year-old male, he struggled with long COVID and fatigue, very long time, and poor healing. He expressed dissatisfaction with improvement in his shoulder after the BPC 157 and thymosin beta 4 and would like to continue. He says it's also improving his dental pain, which we heard about earlier in the studies that it can help with periodontitis, so dental pains as well. So this patient, we have an MRI here, injured knee on the tennis court. We have obliquely oriented radial tear, the posterior one-third of medial meniscus. We have meniscal tear, we have popliteal cyst, we have a joint diffusion. We performed intra-articular injection of the Wolverine, 1 milligram, 1 milligram each. This was without PRP. And I dispensed her it to continue home sub-Q injections. She followed up and relates that her knee feels fine and she will not be considering surgery now that she knows about the peptides. Right? Quite remarkable. This is a 28-year-old female post-COVID losing weight. She has a diarrheal illness. I think this was the norovirus we just saw sweep through our community. We gave her oral BPC 157 and she's done 2 doses and her diarrhea cleared up. She's not losing weight anymore. She's still fatigued from it. And she says her baby is also a lot less fussy. So the peptides, really anything you give to a lactating woman is going to go through the breast milk. So it's quite possible some of the peptide went to the child as well. And not too worried about this. It's a natural peptide and it helped the child be less fussy. 31-year-old soccer pro, he has half-year Achilles tendon tear nagging him. I showed him how to do the injection into the Achilles. Within a week, the pain was resolved. This is a diabetic type 1, chronic diarrhea for years. Primary does keto, does long-acting insulin, and short-acting. We give him BPC oral, and it cleared up the chronic diarrhea of years in 1 week. This is a 35-year-old female with severe Crohn's. So this patient, she got the runaround with conventional medicine, and long story short, she had rectum removed. She now has a bag. But even with all that, with even so much intestine removed, she was still having severe Crohn's and required monthly Entevia infusions, with it's a very powerful and expensive immunomodulator. I gave her BPC 157 and KPV orally, and this has resolved her condition so much that she no longer goes in for Entevia infusions, saving thousands of dollars per year. And she feels the best she's ever had in years since she went down this conventional road. I'm very happy that she has such a good effect and feeling so much better.
Let me add, this is very important part, the Crohn's disease that you have here. I
Yes.
mean, this is like phenomena. And this is shows that those Crohn's disease, they are Th1 dominant, Th2, Th1, Th17 dominant inflammation. And You do steroids, you're suppressing the whole thing, you're putting infection. The immune modulators, they don't work that well because of all the side effects that you get. But thymosin beta that you have given and the KPV, which is the peptide derived from melanocyte stimulating hormone, right? Those two and they are immune modulator and they inhibit the Th17 and Th1 and polarize the immune system into Th2 and Treg, which eventually helps to completely help and reverse the pathology of the Crohn's disease. Especially if those peptides is being loaded with cyclodextrin, you will get even way more effect 10 times. But even without it, you still get the results there. So
Yeah.
this is very powerful modulator drug that as you mentioned, it's better than even those immune antibodies that they are doing, those big pharma, and it's more safe, more effective, and it does heal the leaky gut as well, part of it, the membrane. I think what you accomplish here for Crohn's disease, it's phenomena, and it needs to be translated into mainstream medicine. But hopefully RFK will remove the stigma on peptides where the doctors can fairly practice it.
Yeah, it would be nice to remove the stigma and then they could be used more often. But interestingly, the KPV may actually reach prime time mainstream medicine. This is in stage 2 or 3 clinical trials. I might do a lecture on this alone at some point. But it's great immunomodulator. That and BPC is fantastic for inflammatory bowel diseases and Crohn's. So, and we use it quite extensively for these gastrointestinal diseases. This patient, so this was back in the days when Mike Bomer at Amex Pharmacy, he could do BPC 157 and nitropase, and he would do this all the time for me. And we could apply it onto patients' rectums for hemorrhoids and fissures. It was amazing. You would get both the vasodilation, the nitric oxide, the perfusion, the blood going to heal the area, and then you would also get the healing and regenerative effect of BPC 157. And we have phenomenal results with this, but then Amex went away. We couldn't get it anymore. Haven't been able to get this since.
Okay, you can get it. If you ask Mike Will, he will make it, or Strive Pharmacy if they can make it. Uh, but I think it's not hard to do. I actually thought Mike Beamer about nitroglycerin it's a good thing for hemorrhoid. It's actually analgesic, the nitroglycerin. In addition to it's killing all those bad bugs in the hemorrhoids. Plus the BPC, you can you can get those pharmacy doing it for you. I don't think that's a problem.
No, I haven't found one yet. We'll see. I'll keep working on that.
Right.
Let's see. This is Wolverine Protocol plus Nandrolone, which I've maybe given to this group before this lecture. This patient has multi-disc degeneration and bulges, lumbar spine all throughout. He says the healing protocol almost feels too good to be true. I took one injection the other day and noticed an immediate improvement the following day. I wasn't without pain, but the difference in the pain from one day to the next was astounding. I'm looking forward to the results. You do a great job. Thank you.
Where are you injected? In the back?
This was subcutaneous,
Okay.
systemic. Yeah. This one, 41-year-old male, chronic rotator cuff, labral pain, patellar tendon pain. He cannot lift weights, low testosterone. Gave him Wolverine, both shoulders, and then he states he feels amazing and cannot believe how well it works. He's also starting TRT. I think if orthopod sees male with low, with a injured joints, non-healing ligament tendon. Measure the testosterone. These men are low androgen males. They have low tensile strength in their ligaments and tendons. This is why they're fraying. They don't need more surgeries. They need to first, you need to give them anabolic steroids. So we need to be comfortable saying anabolic steroids. It helps people heal. And then, yes, the Wolverine too, of course.
Oh, we can make it even more easy terms. Restoring the six hormone balance is
That too.
very critical for patients above 50. And if you
Right.
do that, you normalize a lot of the pathology that the patients experience.
Yeah. I mean, the orthopods are so busy. They're cutting into people every day. They're making so much money. They need to test the testosterone. This is a peptide we've been using a lot for the gut, for healing. Extensively we use it. It flies off my shelf. So anybody with extreme pain It works. Stomach pain. Um, this is a peptide blend of KPV, BPC, immune peptides, some probiotics and prebiotics like Akkermansia. We give patients with stomach pain and this product and the stomach pain it resolves. Um, this is a patient close to the family. I had that norovirus problem. Gave 2 scoops and the diarrhea, it went away almost immediately after 5 days of it. This patient was post-stroke, recovering well, but now on multiple pharma drugs, ASA, Zetia. I think he was also on Crestor for a time. Really bad stomach pain. He couldn't sleep at all because of the peptide, the pain. I gave him the gut peptides and followed up via text day 2, and he says it did wonders and quick. And this was important for this patient because he couldn't go off his drugs. He had a stent placed. I mean, he could stop his aspirin. Um, Here's a gut skin connection. Very interesting. 28-year-old female. Obviously, her skin's very important to her, but she was dealing with acne. I give her the gut peptide, and she noticed that she takes it every day, and when she doesn't, her face breaks out. Again, that gut skin connection there. You modulate the gut inflammation, and then the skin heals. Now, this is my hand. I fell on a tennis court, slipped and fell, landed on my arm like that Fuchs injury we learned about in school. And I could barely hold onto my racket, and I had to withdraw from the match. I gave myself the peptide injections, and I was hitting the fastest serves I'd hit in a long time that same Saturday. This is a 66-year-old female, gassiness, stomach pain. A patient reports improvements in symptoms after starting the peptides. And I said, well, just continue it, see how much further you can go. It's another norovirus in a young female. We gave her IV Myers cocktail, kind of standard fluid repletion after norovirus, and she said it worked almost immediately, the peptide, to help the diarrhea. This is a GERD in a diabetic type 2. She says, hi, Stefan, the gut peptide is amazing. For the past 3 nights, I haven't even reached for the Tums. How long can I use it? When patients ask me how long can I use it, when I say, well, peptide is not a big pharma drug. Peptide promotes a regenerative healing mechanism, and then once it's healed, if you don't re-injure yourself, you don't necessarily need it again, or you can use it maybe on occasional basis. But it's not like big pharma drug. You have to take all the time to like suppress an enzyme or mechanism. It is regenerative. This is a pediatric 15-year-old with pleurisy for approximately 3 weeks. It did not improve. I gave this kid NSAIDs, dexamethasone, colchicine. I mean, I threw the kitchen sink. Zero improvement. And he was out of school for about 21 days because of the pleuritic pain. And I got a text from the parent, and he's like, I got a charge for $355. I'm like, oh, the peptides, Wolverine's not cheap. Uh, but he says, and the next test I get is, I just want to send you some positive feedback. The child is much better. Things are healing. He has still some discomfort, some pain if he breathes or coughs really deeply. But overnight, since he's took the Wolverine, things started changing. We did shot 2 today, so thank you. So side effects, we've really never seen a side effect. One that you might describe as a side effect is this unfortunate young male with a spinal cord injury. He has complete quadriplegia. And we injected the Wolverine protocol to see if we could promote some of healing. What happened was allodynia. So he started getting a full body pain, almost as if all his nerves were on fire and irritated. And I was like, did it go away? Okay. Um, Give yourself another shot. And it happened again, but as he continued the shots over time, it decreased less and less where he doesn't have any of the allodynia anymore. But when you're dealing with a full spinal cord injury where the patient has no sensation, where you have some sensation coming back in places where you didn't have sensation before, is something to note. There's ways to order these oral versions, of course. But we do have one of my peptide reps here in the chat. Her name's Jillian. She can give you her information if you're interested in getting some of these peptides because
After
you
the
can't.
CME sessions, you can come.
Yes, of course. Uh, Mechanism of action, the Wolverine protocol. It promotes the body's regenerative capacities. The BPC is found from the gastric juices naturally, so it's a natural peptide. Promotes tissue repair by angiogenesis, means forming new blood vessels. It upregulates growth hormone receptors, producing endothelial cells and boosting collagen production. The thymosin beta 4 is a synthetic peptide, again, of a natural one found in our own thymus glands, and it promotes facilitates cell migration, promotes stem cell differentiation, reducing inflammation and cytokine storms. The peptides, they work synergistically to amplify your natural healing ability. And this protocol has been used by many bodybuilders anecdotally, but based off a mechanistic approach, it makes very sense to use them both for an anti-inflammatory mechanism with a thymosin beta 4, but also has a regenerative cellular anti-apoptotic effect, and then the BPC 157 that promotes angiogenesis and cell differentiation and healing. So we use them together and we call it colloquially the Wolverine peptide protocol. And I'm hoping that we get more data on this one day, and maybe RFK gets us some bigger human studies because they've been transformative for my practice.
Right. Well, all the peptides, if it's being loaded with cyclodextrin, we get 10 times better effect because those peptides are very easy to be degraded by the tissue enzymes, whether you're injecting it or giving it oral. And
Hmm,
that's the thing that we are hopefully working on. Is any
exciting.
questions for Stefan? Stefan, you did very good, Dr. Stefan. I like the whole thing about thymosin beta, KBV. They are immune modulator without much of side effects, and just the doctors need to understand that where to use it. It's not good for allergy because it does polarize the immune system to Th2, so it may aggravate allergies. I don't know if Dr. Stefan have any experience with people with allergy. You give them his injections and they a little bit get worse.
No, I haven't seen that.
Uh, well, I would not re recommend it for patient with allergies.
Sure.
Because allergies, they have too much of Th2 and thymosin beta can promote Th2 and Treg. Practically, we need to see if that's the case, but we can ask the chat GPT if there's anything he will say about it. Theoretically, we give thymosin beta for patient with autoimmune disease that's Th1, Th17 to move them into Treg and Th2 because they inhibit the Th1 and Th17. But we don't give it for patient with cancer. I do you give it to patient with COVID infection? It wouldn't have the Th17, and COVID is causing by Th17.
I-
But thymosin alpha is better than thymosin beta
Right.
for COVID infection. That's my
Correct.
my say here about COVID and viral
Yeah.
infection because you don't want to move the immune system away from Th1 to because we want to clear those cells that's being infected with virus. And one of the things that COVID does, it's polarizing the immune system away from cytotoxic T cells and Th1 into Th2 and especially Th17. Yes, thymosin beta inhibit the Th17, which is something that's good, but they have something about moving things into Th2, which something that it's not good for patient with cancer and Treg especially. But
Yeah.
other than that, your presentation was great. It's include all the mechanism and all the clinical experience. And if there's anybody here who have any questions for Dr. Stefan, go ahead.
Yeah. Hey guys. Hey Stefan. How's it going, boss?
Hey.
Awesome lecture. I'm a big fan of peptides. I agree with you, Dr. Halasai. The thymosin beta 4 TB 500, I generally tend not to use for my cancer patients. But the BPC 157, I don't think that you can't paint it with a broad brush and just say that it's not good for cancer patients. There are lots of cancers that respond very, very well to BPC 157, and there are lots of preclinical research. Um, hey, hi. There's lots of research uh, showing that BPC 157 is actually helpful in a number of different cancer patients. So I use it especially for the bone marrow and blood dyscrasia cancers, and it seems to do really, really well. Um, but awesome lecture, great stuff. I was wondering, where do you get the injectable BPC 157?
Yeah, my rep here is in the chat, Jillian. Jillian, you can put your
Jillian,
contact.
Yeah, let me stop the recording here for a minute. Let's stop
we're gonna
it.
become best friends, Jillian.
Yeah. Stop the recording. Just
Oh, I can do that for you. You got it.
stop.